a poster. And so today, you can see he was really proud of his work, and he invited his friend to go to his poster. And I always went to their presentation to take picture, as you can see. And so I think this is a wonderful program we have here on campus, and I'm really glad you are taking advantage of it, because this is actually not available everywhere. So I hope you appreciate that, how wonderful it is that you guys have this here. And so let's go to, today I'm going, so this is the topic of my talk. Oh, presenter view. There we go. So what I'm going to do is, so I will be talking about the specific writings in the field of medicine. And before I go into writing part, I would like to introduce my research a little bit. And I ask you that when I'm talking about my research to introduce myself and explain what I do, please pay attention to the structure of how I introduce my work, as well as the choice of the words that I use. And before I start, I have a question for you. How many of you here know what is an arterial venous fistula? Oh, wonderful. Okay, that is awesome. All right, so I am a research professor in the Department of Internal Medicine, Division of Nephrology. So in our division, we do, the faculty in my divisions work on several aspects of renal research. And renal research is a very big area. And generally speaking, the research can be put into three categories. One deals with how does a normal kidney work, and how do kidney diseases arise, and how to treat this kidney disease. So my research is specifically related to treatment. So I will tell you, I don't necessarily know how does the kidney work, but I do know how to treat it when there's a problem. And there are also many different kinds of kidney disease. So for example, you probably heard of kidney stone, which I know very little of. Or you probably also heard of acute kidney injury, such as usually it's a result of trauma or toxin, or some drugs actually can induce acute kidney disease injury as well. But I specifically do chronic kidney disease. So in this large field of renal research, my research is related to the treatment of chronic kidney disease. And there are 5 stages of chronic kidney disease, from stage 1 to stage 5. So the stage 5 is the most serious. That's where a person's kidney has failed. So it is also known as end-stage renal disease, ESRD. And from the number I gave you here, you know that this is a very expensive, both CKD and ESRD are very expensive diseases to treat. So for example, if you look at the Medicare expenses, so in the age group where people are age 65 or older, 20% of all Medicare spending is on treating kidney disease. Now, it's higher than cancer or heart disease you've heard of. So this is a disease that is, the disease population may not be big, but it's very expensive to treat. And then in the case of the ESRD patients, so ESRD patient is less than 1% of the Medicare population, but it costs about 7% of the Medicare expenses. So again, this is telling you that patients in ESRD patients are taking a higher share of the cost. So this just tells this is not a cheap disease to treat. And so the 5 stages are determined by how the kidney filter out the waste and water. As you know, that's the basic kidney function, is to remove waste and excessive water. And so, the metric is called estimated glomerular filtration rate, EGFR. And so when a person's GFR drop below 15 ml per minute, then that's considered kidney failure. And so as I mentioned, in this large group of CKD patients, I only deal with ESRD patients. So this figure shows you the number of ESD-RD patients. This is the total ESD-RD patients in different years. So as you can see, the number is increasing. This has a lot to do with aging, diabetes, obesity are three huge risk factors of CKD, chronic kidney disease. And our population in general is becoming older. And as you know, diabetes and obesity are considered as an epidemic problem right now. And so there are two types. So once a patient has ESRD, there are two types of treatment, transplant and dialysis. I handle dialysis, so I don't deal with the patients who receive transplant. Now from this figure, you know that only about 30% of patients can receive transplant. This is because of organ shortage. So majority, 70% of ESD-RD patients rely on dialysis. And there are two types of dialysis, hemodialysis and peritoneal dialysis. A main difference is that when you do dialysis, hemodialysis, you have to do it, go to a clinical and receive a professional care. Now, so for peritoneal dialysis, you can do it at home. But most of the patients opt to do hemodialysis because PD is not efficient. Yeah, and it's not as efficient. And so among these two groups of patients, I deal with the patient who receive hemodialysis. So this is just to show you that most of the, you can see 64% of ESD-RD patients receive hemodialysis. Now, so this is a patient receiving in a so-called, we call this is a patient in a hemodialysis session. So you can see that there are two tubes that go into the patient's forearm and then go to a dialysis machine. This is a mini pump that pump the blood through a dialyzer. And normally patients who receive dialysis needs to go to the dialysis clinic 3 times a week, and each session 4 hours. So the patient's life quality and freedom is dramatically compromised. So they are hooked with dialysis machine a lot of time. And then so dialysis has two components. One is the dialysis machine that you can see in the photo. The other thing is what you cannot see is under the skin. It's called vascular access. And so my research is related to vascular access. So there are 3 types of vascular access. And one is a catheter, and the other is a graft. This is a Teflon graft put between an artery and a vein. And the other type, the third type is called fistula, where an artery and the veins are sutured together. So the purpose of vascular access is to provide a large blood volume for the dialysis machine to run efficiently. Usually this flow rate needs to be 500 ml per minute. And this is about 1/3 of a cardiac output. So you need a very, if the flow rate is too low, then there are some problems such as clotting. So the dialysis machine can only run efficiently when the flow rate is high. But that kind of flow rate does not occur naturally in our body. Hence, the vascular accesses were placed in order to achieve the vascular the flow rate. And among these 3 types, fistula is the best of them. And this is my focus this is my research. So let me just show you. So this is a catheter, and they usually can only last about 6 months, and by the end of 6 months, they fail as a result of infection or thrombosis. And this is a graft. So this is, as I mentioned, this is a synthetic Teflon graft put in the arm. And you can actually see them kind of, I know, not a pretty sight. And sorry. And then this is a graft. Oh, I'm sorry. So again, you can kind of see them, and they have to be very close to the surface in order for the dialysis needle to get in. We call this cannulation. And then so, as I just mentioned, the care of ESRD patients takes a large share of the Medicare cost, and most of the costs they actually were for vascular access dysfunction. So although dialysis is a life-saving procedure, a lot of time the patients cannot receive dialysis because their vascular access get occluded, so the blood flow cannot go through. So my research is focused on how to keep vascular access open, especially with a focus on fistula, because once the fistula mature, it can be used for several years. When compared to the other 2, catheter usually only lasts 6 months, and a Teflon graft only lasts about 2 years. So ideally, if a fistula can work, this is the way to go. So that's why I asked you, if you remember at the beginning, I asked you, have you heard of arterial venous fistula? So this is an arterial fistula. So it looks like this. You can see them. So in some patients, if the fistula functions really well, you can actually hear the blood flow. Like if you just put your ear on the vein, you don't even need some special devices. And they complain about sometimes they cannot sleep at night because it's so loud. And yes, and then so what I just, the way I introduce my research is the so-called funnel-shaped introduction. I started out by talking about something that's really broad, and then starting from there, I start to tell you like something more. So with each step, I give you more specifics. So imagine if I just come in and start to tell you, well, my research is related to arterial venous fistula, and it's very important. You probably have no idea. First of all, you don't know what is a fistula, and so you cannot appreciate why the research is very important. And so here, there are many different types of funnel. Like you can give different types of funnel-shaped introductions. So how you do it really depends on the context. So what I just gave you is an example of a funnel-shaped introduction. So is it clear so far? Do you have a question so far? All right. If not, so the next thing we're going to talk about is, so now we're going to start to talk about the writing part. So as I mentioned, I've asked you to pay attention to my structure. So here, you know, like the structure that I use is called, this is a funnel-shaped presentation. And then the other thing I ask you is to pay attention is about the word I used. So I know I do speak with an accent. So if we ignore that part, is there any word I use that you have not heard of? Or you actually know most of the words I used, and it's clear. So that's the purpose. So it's very important that when you talk, you give a structure that the people can follow, but also use words that are very accessible to your audience so that your audience can understand you. And that really comes down to the go about, so this is the take-home message today. If you have to forget, if you only want to remember one thing, it's this slide. So the idea here is to write clearly. And there are really only two things you need to remember to write clearly. It's the word choice and the structure. And I want to focus, the key word here is clear writing. It's not beautiful writing, graceful writing, innovative, interesting, or exciting. It's clear. And you write clear by choose the right words that are accessible and to your audience. And you also structures your presentation at different levels, sentence, paragraph, and how you structure your data in a way that is logic. And then, so in addition to word choice and structure, so in general, and for a scientific writing in general, not just medical writing, the first thing is it has to be accurate. And so it needs to be right. And so you should not present falsehood. And generally speaking, try to keep your sentence short, and also structure it logically. Okay. And then so we're going to go through this in the rest of the talk today. And then finally you talk about whether the medical article you're writing, is this a hypothesis-driven or a text-driven article? And if it's a hypothesis-driven article, is your hypothesis, is at the end of your article, you should talk about, yes, my hypothesis is right or wrong. Or if this is a task, has my task been completed? Okay. So as I mentioned, so this is the take-home message today. Any questions so far? This applies to other sections as well, yes. Mm-hmm. Okay. So because of our time, I cannot give you an example for every section, so I chose to do introduction. Yeah. But this applies, the words, the structure, they apply to the entire element of your article. Either it is like a full-length research manuscript, or it's just a conference abstract, okay, which we will talk about next. Yes?
So how do you find the balance between word choice and being accurate? Because it would seem that you need more words in order to be more accurate, but how do you figure that out?
First of all, it's not necessarily true that you need more words to be accurate. Yeah, and depending, so what it does, that's a very good question. So he asked about how do you find balance between accurate or use a long sentence. Is that your question? Let's hear, what do you think? Anyone has opinions? Which one is more important? Keep your statement short or keep it accurate? Accurate? Yes, that's right. So when this is, like I said, so this is a type of scientific presentation. At the end of the day, it is the most important to be correct, right? And if you have to use a lot of words to be correct, that is fine. Okay. So any other? That's a very good question. Yeah. Any other questions? Okay. All right, and then, so the next slide, so you have this in your handout. So this is a longer version of what I mentioned in the previous slides. Again, so you try to write clearly by being direct and concise and well organized and straightforward. In another word, write linearly, don't write non-linearly. So the one example, So for example, when I was talking about my research, you can see that I go step by step. And so one example of non-linearly would be if I jump around. I talk about renal research, and then I talk about ESRD. After I talk about ESRD, I told you, well, there are 5 stages. ESRD is the last stage. And then I talk about what is a vascular access, and then I jump back to tell you there are 2 types of dialysis. Does that make sense? Yeah. So, and then let's do here. And then and most of the bad writing suffer from either, so again here, this is organization, poor overall organization, or using convoluted and obscure use of writing style with too many poorly chosen words. And then the other thing is know the audience expectation and the required writerly conventions. So most of the examples I put below what I'm going to show you next, as well as what I summarize here, comes from this 6 books. I intend to bring them here, but I forgot. Very, very sorry. But I do have all of them. And so if you So if you have time and you are interested, so if scientific writing will be an important part of your career, I would encourage you to read them. Okay. And then so now let's talk about more about specific about medical writings. There are different types of medical writings for different audience and purpose. So we're starting from what you probably exposed most is the news, the medical journalisms. So these are articles that are mostly for general public and lay people. So when you write this, try to write in simple and non-technical terms. And then there's medical education, such as for physicians or for patients. Now, so as you can imagine, the language you use for physicians and patients will be very different. Simpler, you'll use a simple and non-technical language for patients, but you can use something that's professional for physicians. And then there are also medical marketing of the products. And so what you will probably deal with the most in school here is the publication and presentations. And generally there are 3 categories: a full-length journal article, and but it can also be a case research article that reports original findings, or case reports that report specific patients' incidents and treatment, or a review article of these 2. And another thing you probably will be doing if you present at the symposium is to do, you need to write conference abstract, and you also need to prepare poster and presentations. And then the other thing, so this is what I will talk about next. And then the other 2 types of articles are research related to, so these documents are not the reporting the research findings. Those are related to more like a protocol types. So for example, if you are conducting a clinical trial research, you will have to have protocols that's used internally about how patients are recruited and what will happen to them after they participate in the clinical research. And so when for example, once when you recruit a patient, you need to give them informed consent. They need to sign informed consent document before they can start to participate in the research. or like there are also research proposals that you submit to funding agencies to ask for money. And there are also some regulatory documents. These are for example, if you have a product that you want to apply for FDA approval, the FDA will have a whole different type of rules that you have to follow. And so as I mentioned, so today, for the rest of the time, we will be focusing on this. And if you are interested in all the other types, like writing in all the other types, you can look up the references I listed in the previous slide. So any questions so far? So if not, we're going to start to look at the structures of a full-length research article. So there are, generally speaking, two types of structures. They are very similar. The difference is where you put the material and methods. Most of the journals go with the first column. As the article starts with an abstract. Usually this abstract should be anywhere from like 500 to 200 words. And so this gentleman asked a very good question. Sometimes it's very important to write correctly in a very limited number of, when the word limit is small. And then next is introduction. Then you talk about the materials and methods used to do the research and the result of the research, discuss your results, and thank acknowledgement. Now this is not where you thank your mom, your dad, or grandpa. This is usually where you thank a funding agency or collaborators who have contributed, but not enough, their contribution is not big enough to be in the authorship. So these days, some journal would actually request you to justify why some people are put as authors. You have to really contribute substantially. And then disclosure of conflict of interest. So this applies to, for example, if your research is to talk about whether a drug from Pfizer works very well, and you are paid by Pfizer. Now this is where you should say the research, I do receive money from Pfizer. And this is the bibliography and tables and figure lessons. So these are also known as the figure captions and figures and online supplemental materials. So about 90% of journals use this format. Now, some journals would move the materials and methods to be after discussion, and there is a concise in front of it, and all the details can go to supplemental materials. So like I said, most journals don't use this. So generally speaking, this format is used by top tier journals like Science, Cell. Any questions so far? And so one thing to keep in mind is when you write a journal articles, different journals will have there will be some subtle differences. So it's important to look up the journals guides for the authors and follow the rules. And the second thing to remember is that it's very rare that when you sit down to write a paper, you really start from abstract, introduction, and then to the end. That almost never happened, as far as I know. So it's usually you kind of jump around. So I want to ask you, like, how many of you have writing a paper so far? Okay, so those who raise hands cannot answer the following questions. So for people who have not written, so what do you think, like, which section would you start to write? Which one is the easiest to, like, generally speaking, would be easy to write to begin with? Yes, that's right. Generally speaking, you start from this one because you need to have this information in order for you to do your research. That's right. So that's the first one. And then what's the next one? I hear a correct answer, and you can be louder. Yes, that's right. And then you write results, because as you do research, you start to have results, and you can put them into figure and the tables. And then so it's really usually after these two were done, then you start to write, then so the third one, generally speaking, is discussion or introduction or vice versa. So abstract is usually the last to write, because abstract is a summary of what you do, how you do it, and what did you find, okay? Okay, so those who has written it, have you done it differently and you want to share your experience with us?
I kind of like writing the introduction first. It helps get everything together because you have to explain like the background and everything. It helps me kind of collect everything before I start really getting in.
Okay, that's a very good point. And there are also a very important, sometimes I do ask my students to start to write introductions in addition for the purpose of one of them being what he just said about, so you understand what you're doing. But another good, very important thing to kind of do the introduction is to introduce yourself and familiarize yourself with the literature to see whether what you are going to do has been done or not. If it already has been done, then you should stop. So, or if there are any methods that are better than what you are going to do. So we often say that it's actually better to spend like 6 weeks in the library, or these days PubMed, and so it's better to spend 6 weeks doing literature research and to kind of, and then at that point you can start to think about how to write introduction, then wasting your time like spending 6 months in the laboratory doing something like when you're about to publish it and you find, whoops, someone has scooped me, or, well, actually, now they do not scoop you if they have published it like 10 years ago. They only scoop you if they just kind of publish it a month or two. And so it's also, so yes, some people do start from the introduction, and there is a very practical, like a very important reason is you don't want to duplicate what is already out there, and you also want to find out if there are better methods out there, okay? So any other things like that? Okay, go ahead.
Are tables okay, like in the result and discussion section?
So that's a very good question. So actually, you talk about, this is just the format of how you organize your different information in the paper. So you actually do have to refer to math table and figures in your results. They are just put in a different sections. Is that clear? Okay. Any questions so far? So in a real published paper, tables and figures will be mixed with the results. But when you, in the manuscript you submitted, they are almost always separated. Okay. All right, and so if not, I'm just going to show you an example of my research, an example paper of my research in arterial fistula. So this is a paper in radiology. So this is the paper's title, and this is the list of journal, and this is the abstract. So you can see even the abstract is structured to have different elements that tell you different things. This starts from the purpose, materials and methods, results, and conclusion. So this goes back to, this is usually the last part being written because it has everything, kind of the essence of what you write in the other. So the purpose would be a very succinct introduction. How about that? Like just like 2 or 3 sentences. And then this is a succinct methods and succinct results and conclusion. So this is usually the last written. And then the next point is introduction and the methods material. And in some journals, such as this journal, they would have some special sections, such as here. This is called Advances in Knowledge and Implications for Patient Care. So these are the bullet points to highlight this research. It's kind of like if you go to CNN News website, and each news article usually will have a few bullet points to the left. Or so, okay, if you've never visited the CNN website, just give it a try. And then, oh, and I do not receive any payment from CNN. So that's the disclaimer of conflict of interest. And so not all journals have this though, but some journals do have this. And then after that, you talk about results. And then so this is where, so you can see, so when the paper is published, tables and figures are actually together with the results. Yeah, and then after that, we have discussion and references. And here, for this journal, this is a very long list of acknowledgement because this is a multi-site, multi-centered clinical study, and this is the disclosure of conflict of interest. Right. So that's the example. And then, so as I just mentioned, some journals have some specific sections, such as the implications of medical care. I just show you all the advances in knowledge. And some journals has some specific requirement in the method section. So usually they are related to ethical regulations, like to human or vertebrate animals. So for example, in this journal, CJSN Clinical Journal of Associations of Society, American Society of Nephrology. So this is the best clinical journal in my field. And so they talk about in the method section, you have to specifically talking about, you have to address, so I'm sorry you cannot see clearly. So the first one is to address the human subject. So when you do human research, your protocol needs to be approved by Institutional Review Board, also known as IRB, before you can do the research. And so they would, like this journal would specifically say that in your method section, you need to say your research is approved by IRB, and it also follows several declarations that to treat your clinical subjects humanely. And also, then if vertebrate animals are involved, then the protocols needs to be approved by the so-called IACA. So there are certain language that some journals would. This is really about liability and accountability. They would specifically ask you that you have to have this kind of language in the journal. Not all journals use the same kind of, you have the same rules. So the next we're going to talk about conference abstract. So usually a conference abstract can be anywhere from 500 words to 1,500 words. It really depends on which journal, which conference you are submitting your abstract to. And so the so-called like the 15, if I don't consider a 1,500 words article an abstract. It is usually called an extended abstract. So it is, but that it does happen to some journal proceedings. And but whether long or short, they usually have these 4 sections: background, materials and methods, results and conclusion. So as you can see, this is the structure is very similar to a full-length article. And so this is an example of my abstract that was accepted by American Society of Nephrology annual meeting. So this is the biggest meeting in my field that we go to every year. And so here, so you have title, author, and affiliation. Then this is the short background, methods, results, and conclusion. And here are our figures, the results, the figures for the results. And so in terms of a poster or presentations in a scientific medical conference, the structure is also really similar to the conference abstract. You talk about, or a full-length journal article. First, you give a background introduction, then you talk about how the research is done and what materials are used. Then you talk about results and conclusions. And so this is an example of the poster we presented. So this poster is from this abstract. So you can see, so basically our poster is an expanded version of the abstract. We basically expanded the introductions more, and we also added so the basic elements are introduction, methods, results, and conclusion. So here we do, we added something, so this is just something we like to do as a group. Like we add a hypothesis. What is this? So this is a hypothesis-driven research. So this is not needed. But sometimes, so when you do poster, generally speaking, when you do an abstract, you have to follow the rules to a T, kind of like when you are doing a journal, submitting a paper to a journal. But when you do poster, you can be a little bit creative to kind of add something that you consider to be more important. But generally speaking, that's pretty much. You can add some elements you want, but there are certain rules that you cannot be too creative. So for example, title is almost at the top of the poster. Don't put it elsewhere. And then after title is author's names. Yeah, and then the flow is usually left to right. Any questions so far? I think I'm speaking a little bit faster than I do. I'm nearly done, but But I think what we can do is we can go over the examples I prepared slowly. Okay. So, but any questions so far? Right. If not, so this is just to talk about. So as I said, so this is so that's the next example we're going to do is to go through several elements in a journal article, and Stephanie will email the following to you. So don't worry if you cannot, you don't have to write it down. Okay. So let's start from introduction. So here is now again here. So this is a funnel shaped introduction, except the content is different from what I do. And so here, you can see this introduction structure is starting from, so there are 4 sentences here. It starts by telling you what is known and explain what is unknown. And then so from the unknown, what specific question does this paper ask? And then it's a very short summary of the experimental approach. Okay, so, I'm sorry. So let's read it together. So here, so it talks about, so first, it talks about that it's known that several anesthetics, including barbiturates, they can depress the bronchomotor response. And so here, this to vagus nervous stimulation, so it's here. And so this is known. So what do you know from this sentence? Several things are known, including this drug's effect. So this drug's effect is known. Then in the next sentence, however, the site of the action is not known. So the effect is known, but the site, the location where this effect occurred does not know. So C is the specific question is, so they want to determine which site in the vagomotor pathway is the most sensitive to this drug. So the specific question is, so effect is known, but the site of the effect is known. So the question is, where is the location? Which site is more sensitive? And so now we go to the a very concise experimental approach. So to answer this question, they isolate the rings of ferret trachea. So based on this is the trachea. So they basically isolate, so it's a tube, so you cut it into rings. You kind of cut it into small elements. And so basically you have trachea from different locations and stimulate them with the drug and see which one has the highest response. So, and so this is just a cartoon about from this paper. It tells you that, so this is the ferret trachea and the different locations were cut and then exposed to the drug. So is this clear so far about this funnel shaped introduction in this specific case? All right, so next let's look at the material methods. So this is from a different paper. So when you talk about the materials method, or some people will refer this to study designs, it's the most important to talk about what are independent variables, what are dependent variables, and then you talk about control, and then before you go into details, is to tell people that so if we use this as an example, so here is, so in this paper, they want to determine that whether the pulmonary C fibers reflexive evokes increase. So when you stimulate the pulmonary C fibers, it will increase secretion from this gland. So they stimulate the pulmonary C fibers with the capsaicin. This is a chemical that you can just you get from red pepper. So you actually can get it naturally, and this is a drug that's used to treat inflammation, and so you can actually buy it over the counter. So basically, so here the independent variable is the stimulation, and the dependent variable is the secretion. Does that make sense? Okay, so far, are you still with me? So this is your treatment. So this is your independent variable. And you want to know whether how the I think in this case they use dogs. Yeah. So, and how the dogs response. And then so what they do is they do at a 10-second interval for 60 seconds before and 60 seconds after each injection. So they basically inject. So they inject the drug into each of the 9 dogs in the right atrium, and then they measure for 10 intervals before 60 seconds and before and after injection. They measure the secretion. Okay, so this is so F sentence describe what they do. This is what they do to measure the dependent variable, which is the secretion, and then the baseline. So the baseline is before the injection, and then the sentence G talks about the details, like what are the sham controls. So here the control is the drug. So some drugs. So in this case, as you can see, this treatment is rather invasive. You have to inject something directly into the right atrium. So this treatment procedure itself may cause some response. And so the control here, independently from the drug. So independently, you will give in the control dogs, they will still get injection, but they will be injected with the vehicle that is neutral, biologically neutral. So this is we call it as a sham control. So the dog is still undergoing injection related stress or complications, but the dog are not exposed to this drug. So any questions so far? So the most important thing here to remember is in the materials and methods section, when you talk about your study, you need to talk about what are independent variables and what are dependent variables, and the control needed. So the next is results. So here, basically, when you talk about result sections, you usually start from the most important figure and the last important figures. So we have a joke that if you have 7 figures in your result section, usually figure 7 is not important, and people will just look at figure 1 or figure 2. Although I personally do not agree with that. I feel all my figures are always important. They tell different stories. But generally speaking, you talk about put the most important results the first, and then you talk about something. I won't say it's the last important. I would say more tedious results. You put them next. Okay. And so for example here, this is results talk about incubation of rim from fetal lambs. Fetal lamb ducts arterioles in arachidonic acid, looks like this. It will increase the production of prostaglandin E2 to 3.5 times baseline value. So basically, this is talking about, so this is something, this is a independent variable. When you stimulated the arterioles to this arachidonic acid, it will release the prostaglandin, which is something that would relax blood vessels. And this relaxation is 3.5 times higher than baseline. And then if you give the blood vessel an inhibitors, so this is the inhibitors, and this inhibitors would block this arachidonic acid's action. So this is the most important results from this study is this chemical induce the production of prostacyclin, but this drug can inhibit that action. Okay. And then there are some other details. And then here is then we are going to move on to discussion. I think the most important thing in the discussion is to discuss at the beginning of your discussion, talk about what are the answers. So like I said, generally speaking, there are 2 types of research articles, hypothesis-driven or text-driven. So the answer would be, is my hypothesis right or wrong? Or have I been able to complete my task or not? And then you start to expand. So you summarize, basically you summarize the most important results at the beginning of the discussion, and then you start to talk about other details. And usually the discussion would end with some kind of a reflect on your research. Usually we call it a limitation. I think what I do is right or wrong, but there are some limitations to this research. And then the end the last paragraph of the discussion is usually again a reiterative answer, and as well as communication, or limitations, but in a very short. Usually this would be just several lines. And then so at the end of the discussion is conclusion, and conclusion is usually even very short. It basically reiterates the question and provides a simple answer. So for example here, the question you ask at the beginning of the research is whether liquid leaks directly from edematous blood, and we conclude that this doesn't happen. So this may sound really simple to you, but I have read papers that say something differently, but they usually will not. You will not see them in published papers, because after you submitted your papers, there will be reviewers and who reviews the papers and give them comments and correct things like, hey, you at the beginning you asked the question, but your conclusion is dealing with something very differently. So those kind of mistakes usually were taken care of at the so-called peer review steps. Yeah. So oftentimes you don't, you probably won't find something that is so terribly wrong in the published journals. All right. And then so this is just to reiterate what we go through today is remember when you write, the most important thing is to write clearly, and you write clearly by choose words wisely, and also structures your articles logically. And so here are just a few, I think so we still have a few minutes, so let's do some exercise. So let's look at this word choice. So the first one is, I think I only have 3 more slides, so they are just examples. So let's look at here. The first one is increased knowledge of cardiac muscle function has greatly enhanced or improved our ability to detect and quantify disorders of myocardial contraction. Okay, enhanced or improved. I do have an answer, so this is from the last reference in the list you have. So you can find the answers. If you like to do exercise, I personally, in the list of the reference I gave you, my favorite is the bottom one because it has a lot of examples and like exercise. Anyone want to try? Or how about this? Let's both see which one improve or enhanced. All right. Do you think it's enhanced? All right. We have 4 votes. Thank you. Improved. A little bit more. Stephanie, could you tell us why you choose improved?
I had this whole reason in my head before you asked me to say it. Okay, so increased knowledge of cardiac muscle function has greatly improved our ability to detect and quantify disorders of myocardial contraction. Because enhanced to me seems like you added a feature of depth of color, like something small has happened, but the point here is that something very large has happened. It's not like a tiny feature got a little tweak to it. It's that the overall process is much greater now.
That's right. Good, thank you. How about anyone who said enhanced wants to talk about why they chose enhanced?
I chose enhanced because when I think of enhanced as far as like methodologies and methods, something has happened that has allowed you just to see a bigger picture.
Okay.
So that's why I thought of enhanced. But I guess to be fair to the argument over there is that you could say that since that's kind of from the viewpoint of methodologies, that improved would be better if you're going with that argument, because that was a change of methods and this is just talking about increased knowledge.
Yes.
So that's where I could be swayed, but that was my reason for enhanced.
Very good. Yes, so the right answer here is improved, because this is a verb that is tied to an improvement in terms of a very specific methodology. So it's more tangible. Tangential? Yeah, tangible. It's more tangible. And enhance is something that's more not tangible. So there are some subtle difference. So for example, if I am going to write a grant application, I talk about some methods, some methodology you can improve. So for example, I just talked about vascular maturation failure. So my title would be my treatment, such as, let's say, anti-inflammation based approach to enhance dialysis vascular maturation. I would use enhance in my title. But when I really write grant applications in those like logistic, and when I talk about methods, I would actually switch to use improved. So there are some subtle differences there. All right, how about the second one? 75% of 75% nitrous oxide represents or is a subanesthetic concentration in the dog. Anyone want to say me? I know the answer.
I think it is.
Yes.
It just seems that this is a really kind of objective, matter-of-fact phrase.
That's right. So here, the right word, so the most, actually both are okay, but they are, if you use is, it is not more clear. It is, right? And when you say represents, it's more vague. Okay, right. So yeah, so very good. Now number 3, the response was blocked by drug, but it was not affected or affected by another drug. The first one? Yes, that's right. It should be the first one. Okay, that's a verb. Okay, the last one. This should be very easy. The Dixing amount concentration content level was increased from 0.5 to 2.5 milligram per ml. I think the unit gives you the hint. Right. That's right. This is a concentration. Okay. All right. And then the next one is, so the exercise I want to do is the data structure. So this is a research that designed to tell you, like, so you have two variables. So the independent variable is time. So how the temperature changes with time. So you can see, so A is one way of structuring your data. So at 15 seconds, the temperature is 32, but when the time is 0, the temperature is 25 degrees C, but when the time is 6 seconds, temperature 29. Now this is what I would call convoluted or nonlinear. Yes, I see someone shake your head. You do not report your results like this, right? So one example to show, to make it better, is to do it this way. So you put it in 2 columns. One is the temperature and the other is time. And generally speaking, you go from either low to high or high to low. Do not go it non-linearly. But as I just mentioned, so in this research, this is an independent variable. This is a dependent variable. Generally speaking, you list independent variable first, and then dependent variables next. Okay. And then I think the last 2 would be hard to do it in the lecture here. But you, as I said, you will have the PowerPoint slides, and so I encourage you to read through the sentences, the paragraph here, and then compare how these 2 are different. And you want to write like the bottom one, not the top one. And then there are 2 examples here. So I think so. That's all for today. So we still have like 5 minutes left. Any questions? Or are we still at? Does it end at 15 or yes? Okay. Any questions?
Way back at the beginning, when you were talking about your research, you showed a graph showing an increase in ESRD. So, do you think that's due to aging population or a change in like external factors that cause the disease to occur more?
I see. I am fairly sure that climate change has nothing to do with increasing ESRD. So I'm just joking, yeah. But I do think, I stand by what I just said. I don't think that's it. So I do not know exactly, but as I mentioned, it is known that aging diabetes, obesity. Those are three independent risk factors for kidney failure. And this is a population that is getting older, heavier, and diabetic. So we use those to explain why ESRD has become more prevalent. But those alone cannot explain this situation in certain countries though. So for example, ESRD is also increased in like underdeveloped countries, like in the third world. Now in those worlds, as you know, diabetes is usually and aging are not that prevalent there. But the obesity is also a problem in third world. So and we know that the fat, excessive fat, does a lot of things to our body. So it does look like obesity is a common ground. However, if you ask the people like, why is the population become fatter, bigger? So, and as I mentioned to you, even people in third world are becoming bigger. And so there are some papers talking about this is a result of environment. So for example, so there are some papers talking about, for example, an increase in population, like so this is association, I want to say the following, what I'm going to say is people look at the density, population density and obesity. It has been reported that higher population density is tied to obesity. And so then that's an environmental factor. So while environmental factors have not been shown to induce ESRD, but the environmental factors have been shown to cause the risk factors for ESRD. Is that clear? Well, thank you so much for coming.